In this video, I'll be sharing the research data on Whoop compared to other wearable devices and why I personally do not use it clinically with patients as a health and wearable tracker. And stick around to the end and I will share my favorite wearable device. My name is Dr. Mike Smith. I'm a naturopathic doctor, board certified in biofeedback, and I specialize in performance medicine. As a doctor, the one metric that I'm looking to be as accurate as possible is HRV, or heart rate variability. It's the amount of time measured in milliseconds between one heartbeat and the next. And it's measuring insights into the function of our nervous system and its ability to adapt to stress, both physically and mentally. So Whoop is a wrist wearable PPG device. PPG, or photoplethysmograph, is an optical technique for detecting blood volume changes within the blood vessels by changes in light received from the photodiode to estimate heart rate and heart rate variability and oxygen saturation and these other things. It was designed for athletes to assess how much to exert or push themselves based on the prior day recovery. Whoop's HRV measurement calculates RMSSD, which is a measurement of autonomic strength and balance, but it only measures the first 5 minutes of slow wave deep sleep, instead of measuring and averaging the entire night's worth of data. Slow wave sleep, or deep sleep as it's more commonly referred to as, is the deepest period of sleep, and it's the time when the nervous system is the least responsive to other influences on HRV, such as the erratic breathing that we tend to see during REM sleep. Whoop's argument is that if you take the average across the entire nights of sleep, there's more variance, and so the data is more prone to influences on HRV, resulting in less reliable data. Slow wave sleep is thought to be important for physiological recovery from exercise, a hypothesis that is supported by synchronization between slow wave sleep periods and growth hormone release, suggesting that deep sleep provides more optimal anabolic conditions. Since HRV is a measurement of autonomic nervous system status, which in turn is considered a marker of physiological recovery to perform exercise, Whoop suggests that HRV be assessed during slow wave sleep, since it may be used to quantify the magnitude of physiological recovery facilitated by slow wave sleep. Although a lot more research is needed to confirm this, and it is still very much a working hypothesis. Furthermore, given that Whoop has only moderate sensitivity in accurately identifying sleep stages, as confirmed by various studies, in fact, one in April of 2020 showing sensitivity for slow wave sleep was only 62% accurate. That's not good. And because it's hard to control for that variable, the last 5 minutes of slow wave sleep, it certainly pulls into question the validity of their measurement method. And it could be measuring a different time every single night. One night it could be 2 a.m., another night, 4:30. There's little consistency, which makes interpreting the day-to-day variability more challenging and much less reliable. I will say one positive thing about Whoop, and that is their tags, or their daily journal, that helps to track how certain lifestyle factors are impacting sleep, recovery, and performance. You can tailor design it for your own needs so that each morning it will ask you the same questions. You can also quantify some of the data. For example, if you've had caffeine, it will make you answer how much and at what time of the day you consumed it. Same thing for supplements, meals, alcohol use, etc. These are screenshots of most of the journal, so you can see everything it asks you about. It even lists masturbation, so they have thought of it all over at Whoop. So it's by far the most robust and comprehensive list as far as prompted questions to these various lifestyle factors that impact our recovery and performance. However, unlike all their competitors where it's just a one-time purchase, Whoop has a membership model. And I don't really like membership models. I'm sure, like most of you, you've got a dozen different monthly memberships to something, and I don't need one more. So that's something that I don't like. I'd rather you just, one-time purchase and you've got access to the basic data. And then if you want to, then there's subscriptions to get, deeper metrics, perhaps. I know a lot of people are probably thinking I'm going to say Oura is probably one of the best wearable trackers. I have used it a lot clinically with patients. However, I've been questioning Oura's data recently, especially with their most recent update. I had one patient that had 42 minutes difference in their total sleep time at night. So that's huge. And I've recently been starting to question their data. I don't have any concrete data yet as far as research studies, but That's a huge swing, and I'm personally kind of starting to move away from it clinically, using it with patients. My favorite consumer wearable device is actually Biostrap. I was explaining the pros and cons of some of the different wearables to a patient of mine last week who was interested, and he got excited and pulled up Biostrap's website right there on his phone and said, I'm going to buy it right now. And I said, wait, I've got a code for you to get a discount. So I've included that link down below so that you can get the same discount if you're interested. And in another video, I will review and explain why Biostrap is this doc's favorite wearable device.